Thank you, everyone. Good day, everyone, and welcome. We are pleased to present this online webinar entitled The Truth About E-Cigarettes and Your Patients. Our featured presenter today is Dr. Michael Fiore. I am pleased to welcome all of you to this program, which is co-sponsored by the American Medical Association, Chicago Department of Public Health, and the Illinois Academy of Family Physicians. Please note that today's webinar is being recorded, and all participant lines will be muted during this broadcast. Today's presentation will last 60 minutes and will include a question and answer period at the end of the presentation. You can submit a question at any time during the presentation using the chat feature in the left-hand side. To do so, simply type your question into the chat box and then click on Send to submit your questions. Please keep questions general and not specific to a situation or affiliation. Today's webinar is available for CME credit provided by the Illinois Academy of Family Physicians. To receive credit for today's webinar, you must log on to www.iafp.com/education and complete the evaluation titled Truth About E-Cigs and Your Patients. You must register on the IAFP education website to gain access to the evaluation. Registration takes just a minute and captures only your contact information for accreditation purposes. A certificate will automatically be generated after you've completed the evaluation and can be printed out for your records. Please note that our speakers today have nothing to disclose. At this time, I'd like to introduce Dr. Bashara Shukar, Commissioner of the Chicago Department of Public Health.
Good afternoon, everyone, and welcome to the Truth About E-Cigarettes and Your Patients webinar. I'm honored to be here today, and I want to thank Dr. Michael Fiore for sharing his expertise with us today, and also the Illinois Academy of Family Physicians and the American Medical Association for co-hosting today's event with the Chicago Department of Public Health. Before introducing Dr. Fiore, I wanted to share with you the policy efforts happening here in Chicago to help with you do your job of keeping your patients healthy. As a family physician myself, I know how challenging it can be to help patients overcome tobacco addiction. We at the Department of Public Health here in Chicago are proud of our efforts to help make the environment in which our city residents live in be one that supports wellness and health and supports, not undermines, your efforts in the clinical setting. So right now here in Chicago, cigarettes have to be behind the counter, out of reach of children. This is not true of e-cigarettes. In Chicago, stores have to have a special license to sell cigarettes and other addictive tobacco products, and this is not true of e-cigarettes. In Chicago, retailers that sell cigarettes to kids can be fined and have their license revoked. Those penalties do not apply to retailers who sell e-cigarettes to kids. So Chicago City Council passed an ordinance in January that will take effect next month and that will fix all of these problems. This is a big victory for public health, an important step to keep Chicago's youth healthy. And I want to use this opportunity to thank all of the healthcare professionals who helped providing the right support to make this effort become a reality. The other thing this ordinance will do is include e-cigarettes in the Chicago Clean Indoor Air Act. What this means is that their use will be limited in most indoor areas and cannot be used within 15 feet of building entrances. It is also important to note that this is not a ban. Even after this ordinance goes into effect, e-cigarettes can still be sold at all the thousands of retailers that already sell tobacco products, and they can be used in private or outdoor settings. I also want to point out that throughout this whole process, as a department, we did not weigh in on the harm reduction aspect of e-cigarettes. Really what this ordinance did is two things and two things only, is protecting kids from becoming addicted to the nicotine habit and making sure that our residents continue to enjoy clean indoor air. I also want to point out a couple of other big policy wins for tobacco control in Chicago that we were able to introduce over the last few months under the leadership of Mayor Emanuel. The first one is our tobacco tax. And now in Chicago, there's a $7.17 tax per pack, which gives Chicago the highest tax on tobacco products across the nation. And this is particularly important given that we know how price-sensitive youth are. And the other policy when that Chicago City Council was passed an ordinance last year to ban the sale of flavored tobacco products, including menthol-flavored cigarettes, within 500 feet of schools. And both of these policies are also targeted to making sure that we're protecting kids from becoming long-time smokers. So with this quick overview of what we're doing from a policy perspective at the City of Chicago, it's now my pleasure to introduce Dr. Michael Fiore. In brief, Dr. Fiore has been a true public health champion for tobacco prevention and control for decades. To name just a few of his crucial contributions, Dr. Fiore served as chair of the panel that produced the United States Public Health Service Clinical Practice Guideline, Treating Tobacco Use and Dependence in 2000, which provides a gold standard for healthcare providers. He has written numerous articles, chapters, and books on cigarette smoking, and was a consulting editor for the 2000 Surgeon General's report, Reducing Tobacco Use. Dr. Fiore continues to serve as director of the University of Wisconsin Center for Tobacco Research and Intervention, and serves patients as a general internist. Thank you for being here with us today, Dr. Fiore, and without further ado, I turn the mic to you.
Dr. Fiore, if you're unable to advance the slides, just say next slide, and we can do it here for you.
Thank you very much. Thank you for that kind introduction, and thank you everyone for joining us today for this webinar, E-Cigarettes, a Public Health and Clinical Update for 2014. As mentioned, I have no disclosures to report, and want to start by providing an overview of what I hope to cover this afternoon. I want to give an update on e-cigarettes in 2014. I want to discuss some of the key public health and clinical issues that relate to e-cigarettes. And finally, I want to end with what in my view is a reasonable clinical approach when we're confronted with a patient who tells us they want to use e-cigarettes. But before I get into this topic, I just want to take a moment and step back and have us really acknowledge all of the good news we have around reducing tobacco use in America. Just 2 months ago, the 50th anniversary Surgeon General's report was released at a White House ceremony, and at that time there was a celebration of the fact that tobacco use rates in America have declined over the last 50 years from about 43% of all adults to about 18% today. And we could really mark that as one of the seminal public health achievements of the 20th century. We've done a remarkable job in reducing tobacco use rates, and clinicians, particularly physicians, can share the celebration because of their key role in helping their patients to quit. But even with this success, we still have about 1 out of 5 adults in our country who smoke, representing more than 40 million adults. Most of them want to quit. Most of them are visiting primary care clinics every year. And this provides us with an opportunity to make further progress in reducing tobacco use rates, particularly using the evidence-based strategies that are available as outlined in the United States Public Health Service Clinical Practice Guideline. So I wanted to just take a minute and acknowledge that good news, the success we've achieved, because I know many of us are challenged by what we do regarding e-cigarettes and how do they fit into this landscape of helping our patients to quit. So to start, a 2014 update on e-cigarettes. I thought it would be helpful just to review what exactly an e-cigarette is. It's a device that typically heats and vaporizes a liquid that contains nicotine. And it's a device that's been designed to mimic the experience of smoking a conventional cigarette that burns tobacco, also called a combustible cigarette. While that's what e-cigarettes are in general, they really represent a heterogeneous group of products. And many of them are manufactured overseas with unclear quality control. The thought is, though, that as big tobacco expands its presence in the e-cigarette market, more will be manufactured in America. This issue of a heterogeneous group of products with most of them manufactured overseas is important because it adds to the uncertainty around e-cigarettes. And this is just a graphic showing just some of the variety of e-cigarette-like products. And as you can see, many media stars are being used to endorse these products. It's a product that's only been around for 10 years. As mentioned, it's heterogeneous. In fact, if you go online, you can find more than 250 different brands. And those brands include ingredients that vary, flavorants that vary, and varying amounts of nicotine that are delivered. While many of the brands are available, a few account for the bulk of the sales, and I'm going to review that in just a moment. Also, there's been a dramatically increased rate of use of e-cigarettes. In 2012, it was estimated that about 20% of all smokers had tried e-cigarettes, representing about 10 million smokers. And their sales also have increased from virtually nothing to about $2 billion in sales in 2013. And to put that in some context, sales of conventional cigarettes total about $90 billion per year. Well, what brands are being sold today? And this is a dramatically changing marketplace, but as of the end of 2013, about 28% of the sales were NJOY products, about 39% were Blue, a brand that many of us have seen advertised in magazines and on television. Logic accounts from about 15% of the sales, and the others represent about 18% of sales. So while there's a variety of brands, more than 250, the bulk of the sales are through just a few of the products. What do we envision over the next year or two? That the sales that are currently $2 billion a year are going to continue to increase, that the manufacturers of these products are going to spend more and more money on marketing, and we envision an increasing tobacco industry presence. We already have Blue, the Lorillard brand, that is being marketed broadly. Reynolds has developed a brand that it calls View, and that is being test marketed currently. And finally, Altria, Philip Morris, is test marketing its product, Mark 10. Well, let's talk about some of the public health issues that relate to e-cigarette, because I believe that there are actually different issues that we need to address from a public health perspective and from a clinical perspective. So I thought we'd go through each of those. And the four key public health issues I'd like to discuss are youth uptake, dual use, secondhand exposure, and the unregulated nature of e-cigarettes. First, what about the risks of youth uptake? Well, the United States Centers for Disease Control is now monitoring rates of youth uptake of e-cigarettes. And just between 2011 and 2012, there was a doubling in the rate of high school student use of e-cigarettes. So when we talk to high school students in 2012 compared to 2011, rates of ever e-cigarette use increased from about 5% to about 10%, and current last 30-day e-cigarette use increased from 1.5% to about 2.8%. We also noted that about 80% of these kids who were using e-cigarettes also reported that they were using conventional cigarettes, smoking conventional cigarettes. One particular concern about youth e-cigarette use is how readily they're available via the internet, and how much of the marketing and the flavorants appear to be directed to entice children into using them. Flavors such as bubble gum, and many of the ads appear to be designed specifically to appeal to youth. A second public health issue of enormous concern is what is referred to as dual use, and that is an individual who both smokes conventional cigarettes and uses e-cigarettes at the same time. And while much of the marketing and many of the news stories we read about e-cigarettes talk about their potential as an aid to smoking cessation, when we actually talk to Americans who are using e-cigarettes, the great majority of them are not using them for cessation and not using them exclusively, but rather are smoking conventional cigarettes at the same time that they're using e-cigarettes. And in a recent study, in fact, 75% of e-cigarette users reported they were also smokers. About 12% reported that they were using them exclusively, and these were former smokers, and about 3% reported that they were never smokers who had picked up e-cigarettes and now were using them exclusively. So while so many of the stories we'll hear relate to cessation, in fact, most e-cigarette users are using them while also smoking. And for many of these people, they're individuals who may be in smoke-free environments during the day, and in those environments are using e-cigarettes, but then return to their conventional combusted cigarettes and smoke them when they're out of those smoke-free environments. Well, one might ask, why is dual use of great concern from a public health perspective? And it's this. If an individual is considering quitting, and considering quitting in part because of some of the social discouragement of smoking, like clean indoor air environments, and that individual instead uses e-cigarettes to get them through the difficult withdrawal periods when they can't smoke, well, what we might then be having is a population of individuals who might have quit deadly conventional cigarettes and instead is continuing to use them because they've got the capacity to carry themselves over with e-cigarettes when they're in smoke-free environments. I want to turn now to a brief discussion about secondhand exposure to e-cigarette vapor. And like so many issues around e-cigarettes, in 2014, as much as we would like to have definitive answers, we just don't. There's little known about secondhand exposure. But with that said, there have been a number of toxicology studies now that have been documented the ingestion of nicotine, of volatile organic compounds, and other chemicals in individuals exposed to secondhand vapor. So the idea that secondhand e-cigarette vapor is exclusively water is not supported by some of the toxicology studies that have been done thus far. And of course, this is an enormous concern for pregnant women who might then ingest these toxic chemicals, exposing both her and her unborn fetus to these chemicals. But it's also a concern for youth who might not have been otherwise exposed to nicotine, and the sensitive brain of youth, particularly as it relates to nicotine exposure, might result in changes to that individual because of that exposure. From my perspective, these data say to me that allowing e-cigarette use as an exemption to the Clean Indoor Air Law is a mistake. And it's a mistake because it may lead to the renormalization of tobacco use. It might even lead to the re-glamorization of smoking, and many of the ads suggest that. Thus, it may negatively impact one of the strongest factors that have discouraged smoking and lowered smoking rates. So we've got the dual concerns of, one, people are exposed to this secondhand vapor, while at the same time we're now renormalizing a behavior that we've spent a lot of time denormalizing. The last point I want to just make about this is, when this is being discussed in localities and state legislators across America, proponents of changing the law to allow e-cigarettes in clean indoor air environments say, well, e-cigarette vapor is less harmful than conventional cigarettes. Well, that may be the case, but the standard should be clean indoor air, not less dirty indoor air. And I just want to join in commending and congratulating Chicago. The ordinance that you have implemented for your city is exactly the sort of ordinance that will result in protecting innocents from secondhand e-cigarette vapor, as well as renormalizing cigarette use as a result of allowing an exception to your ordinance. So kudos, Chicago. The last public health issue I want to just spend a couple moments discussing is the fact that e-cigarettes currently are 100% unregulated. And that is an enormous concern because the FDA has not yet evaluated the safety of e-cigarettes. Irrespective of anything that we'll see in the marketing campaigns, an independent body has not yet evaluated and documented whether e-cigarettes are safe to the user or to those exposed to e-cigarette vapor. And this is of particular concern in terms of long-term potential risks. We need to evaluate e-cigarettes not only from the perspective of whether acutely they appear to be safe, but also are there risks of long-term exposure and safety concerns. Importantly, none of the manufacturers have submitted an application for approval of e-cigarettes as a safe and effective approach for cessation of conventional cigarettes. Of course, any e-cigarette manufacturer can do this. They can back up what they say in their marketing campaigns and do clinical trials that assess both safety and effectiveness for smoking cessation, and none have done that. As a result, we have a situation in which e-cigarettes are unregulated, that e-cigarette manufacturers are marketing these products on televisions, in settings frequented by youth. They're using media stars to endorse them. In essence, they're doing what the tobacco companies did in the 50s and 60s when they mass-marketed cigarettes and addicted half of the adult population to those products. Well, I want to switch now to talk about some of the clinical issues that we face when we're addressing e-cigarettes. And I'm going to, again, focus on 4 of these clinical issues. Are they safe for our patients? Are they effective for smoking cessation? Do they cause former smokers to relapse to using conventional cigarettes? And then another discussion about the risks of dual use. And I'll preface these remarks by saying, as with the public health concerns, we have limited data. Unfortunately, in 2014, these products are so new that we have very little in the way of independent science to guide us. But we're hearing about this every day we're in clinic, thus we have to have some sort of a response. So what about the issue of are e-cigarettes safe? Analyses of e-cigarette vapor as ingested by a user suggest that it does contain primarily nicotine and water, but it also contains detectable levels of a variety of other chemicals. And one challenge is that the heterogeneity of these products, with more than 250 brands on the market, raise concerns that their constituents also vary. So we just don't know what people are ingesting when they use e-cigarettes. And there's been at least one study that has documented acute pulmonary dysfunction among a sample of e-cigarette users. And as mentioned earlier, we have virtually zero information on their long-term health effects. So lots of concerns, but with that said, most people that have analyzed them agree that if an individual totally switches from conventional burnt cigarettes to e-cigarettes, it probably reduces his or her health risk, particularly his or her acute health risks. Does that mean that they are an entirely safe alternative? No. Are they probably safer than conventional cigarettes? If you totally switch, probably yes. Are e-cigarettes effective for cessation? Here too we have few studies. Those studies have had mixed and modest results. The effectiveness that has been shown has been no better than NRT in most studies that I've reviewed. And because, and importantly, because of this limited cessation data, neither the Public Health Service nor the Preventive Services Clinical Task Force recommends e-cigarettes as an aid to smoking cessation at this time. We have virtually no long-term safety data and very limited efficacy data. One important concern is, does this lead former smokers who have successfully quit conventional cigarettes to return and relapse to conventional cigarettes? Very limited data on this, but a growing concern. And it's particularly a concern because in America today, we now have more former smokers, about 60 million, than current smokers, about 40 million. Thus, this is an enormous population at risk. Dual use, I talked about this earlier. This is individuals who both use e-cigarettes and conventional cigarettes at the same time. And as mentioned earlier, if a smoker is contemplating quitting conventional cigarettes and instead she or he begins using e-cigarettes as a harm reduction strategy, there's a risk that it may prolong that individual's use of conventional cigarettes. Why? Because many of the risks of smoking cigarettes are not dose-dependent. Essentially, any smoking of conventional cigarettes results in certain risks, particularly the acute cardiovascular risks. Thus, what we tell anybody who's contemplating this, using both products is not a safe alternative. And it's really important that that message come through loud and clear. Well, I've spent some time talking about where we are in 2014, some of the public health issues, and finally some of the clinical issues. And I want to end by sharing with you what I do today in the clinical setting. I, like I'm sure so many of the people on this webinar, are faced with patients who are coming in and telling me that they're about to try e-cigarettes or have already tried e-cigarettes, and they want to know what they should do about this. And this is a situation where, unfortunately, we have so little science to guide us, but we have to at least respond to our patients' queries about this issue. So our patients are asking about e-cigarettes as a strategy for quitting, and I want to emphasize my comments are around patients are considering it as a strategy for totally quitting conventional cigarette use. And I've come up with a 5-step clinical approach to deal with this. The first is to clearly and unequivocally communicate that the use of any tobacco product, combustible or smokeless, is harmful. But we got to recognize that the most deadly form of tobacco is burnt or combustible tobacco. The second point, to strongly encourage our patients from using any combustible or smokeless tobacco product, and if they're willing to make a quit attempt, help them by steering them in the direction of the evidence-based cessation treatments recommended by the Clinical Services Prevention Task Force and the Public Health Service. And it's advice from a clinician, links to the quit line, and use of the 7 FDA-approved medications for cessation. Step 3, if the patient tells us they're not willing to quit at this time, we still have to give a message that smoking combustible cigarettes is the chief danger and they should limit it as much as possible. And in a New England Journal of Medicine review that's on the bottom of this slide, we provided some guidance to help patients reduce the combustible cigarettes they use, including behavioral strategies, using NRT as they're reducing their combustible tobacco use, and using these NRT products, particularly rapid release ones like the nicotine mini lozenge, to reduce their urges to smoke. Step 4, when discussing cigarette substitutes, in 2014, many patients are going to propose using e-cigarettes. This is not to say that we're recommending to our patients to use it, but rather responding when our patient proposes using them. And what I do in these instances is to let my patient know that the health effects of e-cigarettes are not known, and particularly the long-term health effects of e-cigarettes, but they're probably safer than combustible tobacco products when used acutely. Secondly, if the patient cannot stop or greatly reduce his or her smoking using NRT or behavioral strategies, the patient may decide to use e-cigarettes. And what I emphasize in that instance is the ultimate goal must be complete cessation of combustible tobacco use, and that dual use is not a long-term health strategy. What I finally do is over time monitor that patient. confirm that they're eliminating their combustible tobacco use entirely, and then assist them in quitting all tobacco products, including e-cigarettes. So that is the approach I take with the limited science we have in March of 2014. So to summarize what I tried to convey to you this afternoon, as much as we would like to have more definitive information, the current science available to inform decision-making regarding e-cigarettes is limited. But there are clearly significant public health concerns, including the health risks, youth uptake, dual use, and secondhand vapor. And while challenging, when clinicians are faced with a patient who is considering e-cigarette use, one of the most important messages is to reduce and eliminate combustible cigarette use because it is particularly deadly. With that, I'm going to share with you the website that we have at the University of Wisconsin Center for Tobacco Research and Intervention. If you go onto that website and click on the icon for smokers and clinicians, there is a link to e-cigarettes. And what we've tried to do on this public access website is to provide as much information as possible, and we'll continue to update that over time as more and more research becomes available. So with that, I'm going to bring the webinar formal presentation to a close and open it up for questions.
Thank you so much, Dr. Fiore. I also, on behalf of our sponsors, Chicago Department of Public Health, American Medical Association, and the Illinois Academy of Family Physicians, we want to thank not only Dr. Shuker, who's going to moderate our questions, but we wanted to thank Dr. Michael Fiore. He's been traveling, and he took time out of his schedule to put together this amazing presentation. And I apologize for our technical glitches. We tested the system, and I guess you need to, like they say in shop, you need to measure twice and cut once. And we tested once, and we needed to test twice. So I apologize for that. This program will be archived, and you will receive that link. So if you were having trouble with the audio or could not get it on the phone. It is now time for our question and answer segment. Your participation adds great value to this webinar, so please don't be afraid to send in your questions. To enter a question through the web conference system, simply type your question in the box in the left-hand side of our screen, and be sure to click the send button to send your question. I apologize in advance. We may not be able to get to all of your questions.
Dr. Fiore, thank you again for a wonderful presentation. The first question from Alyssa, could you discuss hookah pens, especially those claiming no nicotine and youth use?
Yeah, that's a great question. What I'm going to try to do is answer them as quickly as possible so we are able to respond to as many as possible. And I say that just to encourage anyone with questions to, as Ms. Williams informed you, write them out and send them in. So, we use the term e-cigarettes, but it really is a hodgepodge of heterogeneous products. There are now e-cigars. There are these hookah products that are very similar. What we know in general is while the products and their delivery mechanism vary slightly, they're all very similar products. And I would say all of the concerns that I raised, as well as the clinical approach that I described, I think is valid for any of these products. Now, to the issue of the ones that are claimed to have no nicotine in them, my big concern about all of this is we just don't know what we're dealing with. And if someone is truly just putting a straw in some water and blowing bubbles. I mean, it's hard to imagine that that's going to be problematic, but it's hard for me to imagine a product that has no active ingredients in it in anybody using it. So I think we all just need to be aware. None of these products have quality control, but the recommendations I provided as well as the concerns I provided, I think, are applicable to all of them.
Thank you. Another question from Susan Wally. Since if the nicotine used in e-cigarette is synthetic, do you still consider it a tobacco product?
Yeah, it's a great point because it's really an important definitional issue that the FDA is going to have to wrestle with. And one thing I did not mention, but the hope is that sometime over the next year or two, the FDA will weigh in on the issue of e-cigarettes. We really need their guidance, their independent review, the asserting of regulatory authority so that this rampant marketing that seems so directed at kids ends. All of that is critically important. From my perspective, I would personally view them as a tobacco product because of the presence of nicotine and the way it's delivered, but that's an area where I'm not an expert, and I'm going to defer to the FDA to make that determination.
Okay, great. Another question that we have here, a series of questions around public health funding to continue doing more studies to see the impact and the health ramifications of e-cigarettes. Can you comment on that a little bit as well?
Yeah, well, I mean, what the challenge here is that the use of these products has come on with such rapidity and with sales literally doubling every year for the last handful of years. The NIH has taken this on as a topic, as have the FDA's Center for Tobacco Products has begun to fund research on this area. We have had a number of independent research studies on this topic, including a number of international studies published over the last year as well. So I think there is a commitment by the NIH and particularly the FDA Center for Tobacco Products to fund research. Of course, the Center for Tobacco Products has to fund research that falls under its legislated mandate. But my hope is that we'll have more and more science to guide us. So I say to everyone, stay tuned. Go to reputable, independent entities to get help and input. And the AMA is a wonderful one that I turn to, and I think we all can as well. And feel free to use our website at the University of Wisconsin, which we will attempt to update on a regular basis.
Thank you. Another question from Donna Lito. How does smoking e-cigarettes affect the baby of a pregnant woman?
What we know, as with virtually everything on e-cigarettes, is that I don't think there's been a single study published of pregnant women, and particularly the impact of a pregnant woman ingesting e-cigarette vapor on the fetus. What we do know is that the major reason why people use e-cigarettes is to ingest nicotine. And we know that the nicotine ingested by a pregnant woman is also shared by the unborn baby. So it is exposing that baby to nicotine at least, and in terms of other things, yet to be determined.
Great. Brenda Fan is asking, do you provide recommendations to patients who want to switch to e-cigarettes with regards to the amount of nicotine based on their regular cigarette use?
Well, first of all, and I hope this message was loud and clear, I don't recommend e-cigarette use to my patients who want to quit. What I do is have a response if they decide that they want to use e-cigarettes. And in terms of the dose, the marketplace is so dynamic that in my knowledge base is not sophisticated enough to say use product A at dose B. I don't do that. And I just want to reemphasize what I said earlier. I do not recommend e-cigarettes to any of my patients. What I do, though, is have a response when my patients decide they want to use these products.
Thank you. Sandra Mandel is asking, why are e-cigarettes legal? Why are e-cigarettes legal, given that we do not know if they are safe or even what they all contain?
That's a paradox, but I guess I'd just come back and say conventional cigarettes are legal, and they're extraordinarily deadly. We know that half of the people who smoke conventional cigarettes will be killed prematurely by a disease directly caused by their smoking, on average robbing them of 10 to 15 years of life. Cigarettes are legal. And as these new products come online, at this point, they're legal as well. But the fact that they may have some risks is not, unfortunately, a criteria to make them illegal.
Great. Dr. Phoenix Matthews is asking, at what point do you think the FDA will take measures to regulate e-cigarettes?
I hope over the next 1 to 2 years.
Great. I think there are a few questions from the audience as to whether the link to the slides or the link to the webinar will be available, and this is just a reminder that a link to the recorded webinar will be sent to all participants. One other question is, what do you recommend, Dr. Fiore, when talking to persons under the age of 18 about the use of e-cigarettes?
I strongly discourage any youth exposing themselves to nicotine, and the reason is the very powerful and growing evidence base that the brains of adolescents have a substantial degree of elasticity as it relates to nicotine. And there's some very intriguing and frankly concerning data that says if an individual under the age of 17 is exposed to nicotine and becomes dependent upon that exposure, that their capacity to break free of nicotine addiction later in life is markedly impeded. The degree to which we can protect our youth from cigarettes, nicotine of any form, is so critical, and that's why a recent move to increase the age of purchase of tobacco products to 21, I think makes so much scientific sense. If we know adolescents are particularly at risk of lifelong addiction, why not, just as we do with alcohol, raise the age of purchase to 21 so we can help protect our children from that exposure?
Thank you so much, Dr. Fiore. And I do want to take this opportunity to thank you on behalf of all of us at the Chicago Department of Public Health on all the work that you've done around e-cigarettes. We've referenced a lot of your work as we drafted our ordinances and as we advanced our ordinance throughout the City of Chicago City Council. I also, as you are aware, there are similar efforts happening through major cities throughout the country, including New York and LA and Philadelphia and others. So this movement is continuing to move along. Again, I want to thank you for taking the time to join us today. For all of those who participated today, I want to thank you for taking part of your day to learn more about the impact of e-cigarettes on your patients. We love it when people interact with us as a local health department, so feel free to interact with us on social media, on Facebook, or on Twitter. And also I want to finish by thanking the American Academy of Family Physicians and the American Medical Association for co-hosting this webinar. Thank you so much, everyone. Again, we'll post a link to the webinar as well as the slides online, and we will send that link to all registrants.
And with that, we must conclude today's excellent online webinar. Again, I want to thank both of our speakers, and I particularly want to thank the Chicago Department of Public Health, whose idea it was to begin this process, to join with Dr. Fiore and the Illinois Academy of Family Physicians and the American Medical Association. In their research, we found that there was not a webinar for clinicians in this fast-moving world of e-cigarettes on what happens when your patients come in. So Dr. Fiore, thank you for that very thorough presentation. We know to be helpful to others with the archive. As registrants, you will receive a follow-up email with the link to view the archived recording, which you can share with your colleagues. It will also include the link to the Illinois Academy of Family Physicians website to view the CME evaluation and credit claim form. If you're interested in attending more webinars on trends in tobacco control and clinical practice, please email Kate Valentine at kvalentine@iafp.com. And again, a special thank you to our presenters, Dr. Shukar and Dr. Fiore, and the webinar sponsors.